Hello, this is Dr. Emma Nichols, and this is the information on the latest US FDA approvals for the week of March 25th through the 29th, 2024, last week. The FDA has approved Sotatercept-csrk, also known by the brand named Winrevair, for the treatment of adults with pulmonary arterial hypertension, PAH, WHO Group 1, to increase exercise capacity, improve WHO functional class, and reduce the risk of clinically worsening events. Sotatercept represents a new class of therapy as the first FDA-approved activin signaling inhibitor for PAH, which works by improving the balance between pro- and anti-proliferative signaling to regulate vascular cell proliferation underlying PAH. PAH is a rare progressive condition marked by the thickening and narrowing of the blood vessels in the lungs, leading to increased strain on the heart. The approval was based on the Phase 3 STELLAR trial, which demonstrated that adding Sotatercept to background PAH therapy significantly increased the 6-minute walk distance by 41 meters at week 24, improved multiple secondary outcome measures, and reduced the risk of death from any cause or PAH clinical worsening events by 84% compared to background therapy alone. The approval of Sotatercept was granted to Merck. Also last week, the FDA approved Vadadustat, also known by the brand name Vafseo, Vafseo, for the treatment of anemia due to chronic kidney disease, CKD, in adult patients on dialysis. This approval marks Vadadustat as a novel treatment option in the landscape of CKD management, specifically targeting those who have been on dialysis for at least 3 months. Vadadustat, a once-daily oral hypoxia-inducible factor prolyl hydroxylase, HIF-PH inhibitor, functions by activating the body's response to low oxygen levels, stimulating the endogenous production of erythropoietin, thereby managing anemia. The approval of Vadadustat for the treatment of anemia due to CKD in adults who have been receiving dialysis for at least 3 months is based on the efficacy and safety data from the INNOVATE program and assessment of post-marketing safety data from Japan, where Vadadustat was launched in August 2020. The approval of this agent was granted to Akebia Therapeutics. Also last week, the FDA approved Ravulizumab-cwvz, also known by the brand name Ultomiris, for the treatment of patients with anti-aquaporin 4, AQP4, antibody-positive neuromyelitis, optica spectrum disorder, NMOSD. Ravulizumab-cwvz is a terminal complement C5 inhibitor and requires infusion only once every 2 months, compared to more frequent dosing schedules of certain other treatments. NMOSD is an autoimmune condition characterized by severe attacks affecting the optic nerves and spinal cord, often leading to blindness and paralysis. The role of complement inhibition in preventing NMOSD relapses highlights the critical nature of targeting the complement system in treatment strategies. The approval of Ravulizumab-cwvz was supported by the Phase 3 CHAMPION-NMOSD study, which demonstrated no relapses in 58 patients over a median treatment duration of 73 weeks. The study's findings are particularly notable, indicating a 98.6% reduction in relapse risk compared to placebo, with patients receiving ravulizumab achieving a 100% relapse-free status at 48 weeks versus 63% of those on placebo. The approval of this agent was granted to Alexion. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc as in medicalcommunications.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more, all for the price of a single freelancer, but with a much wider selection and with a background in the specialty that you need for your specific project. Visit nascentmc.com. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also this week, the FDA has approved Evolut FX Plus transcatheter aortic valve replacement TAVR system for the treatment of symptomatic severe aortic stenosis. This system is an evolution of the existing Evolut TAVR platform with larger windows that enhance catheter maneuverability for coronary artery access across diverse patient anatomies without compromising valve effectiveness or durability. Severe aortic stenosis, a condition characterized by the stiffening and thickening of the aortic valve leaflets, forces the heart to work harder, significantly impacting patient quality of life and potentially leading to heart failure if left untreated. Medtronic's Evolut FX Plus TAVR system is now available for patients across all risk categories for aortic stenosis in the U.S., with a commercial rollout expected in the spring of 2024. Also last week, the FDA approved tenofovir alafenamide, also known as Vemlidy, for the treatment of chronic hepatitis B virus HBV infection in pediatric patients as young as 6 years of age and weighing at least 25 kilograms with compensated liver disease. Vemlidy was initially approved by the FDA in 2016 as a once-daily treatment for adults with chronic HBV infection with compensated liver disease. Subsequently, in 2022, the FDA extended the approval to include pediatric patients 12 years of age and older with compensated liver disease. Vemlidy operates as a targeted prodrug of tenofovir, recommended in guidelines as preferred or first-line treatment for adults with chronic HBV as with compensated liver disease. Chronic hepatitis B can lead to severe liver complications, including cirrhosis and liver cancer if left untreated. The approval for this indication was based on findings from the Phase 2 clinical trial 1092, demonstrating the efficacy and safety of tenofovir alafenamide in a pediatric population. This expanded indication offers a new therapeutic option for younger children affected by this chronic disease, reflecting ongoing efforts to address treatment needs across diverse patient populations. The approval of Vemlidy for this younger age group was granted to Gilead Sciences. Also last week, the FDA approved PEMGARDA, a monoclonal antibody for preventive use in immunocompromised individuals aged 12 years and older who are not currently affected with the virus that causes COVID-19 and have not been recently exposed. This agent operates by preventing the virus from attaching to human cells and is administered through an IV route. It's important to note that PEMGARDA cannot be administered within 2 weeks of receiving a COVID-19 vaccine. PEMGARDA has received emergency use authorization from the FDA, which has requested additional data from the ongoing CANOPY Phase 3 clinical trial to further study the drug. Preliminary results from this trial show that only 1% or fewer of the participants who received PEMGARDA developed symptomatic COVID-19 within 90 days of treatment, compared to 5% in a control group with healthier immune systems. This indicates a potential significant benefit in preventing COVID-19 in people with compromised immune systems. The approval of PEMGARDA was granted to Invivyd. All right, that's it for this week. Thank you so much for listening, and please do tell your colleagues about this podcast. I'm trying to increase the listenership, as always. Just say, hey, this is a really great podcast, new FDA approvals. Check it out on iTunes or wherever you listen to your podcasts. All right, so thanks so much and have a wonderful week. I will be back next week with all the latest FDA approvals.